The one gift I really wanted as a child and didn't receive was an easy bake oven.
Well, the one gift I'd have liked to get as a teenager but I'd never got was a motor scooter.
And I always wanted a Montreal Canadiens sweater, which I always received a Toronto Maple Leaf sweater. So I kind of felt like, you know,
an electronic car that you could ride in and drive around.
The one gift that I really wanted to get when I was a kid was an Atari video game system.
I did really want a 1969 Chevy Camaro.
So the one gift that I really wanted growing up as a kid was a dog.
I always asked my parents for a cure for type 1 diabetes. As a young type 1 diabetic, that was something that I always wanted and looked forward to.
I think like a lot of kids, I wanted a pet cat. We had one family cat. She was kind of grumpy and older, so I wanted a younger, happier kind of cat.
I always wanted a really cool microscope, but they were always too expensive to get when I was a kid. You know, conveniently, down the line, working at St. Joseph's now, we have access to a nice confocal.
The gift I really wanted that I didn't get was go-go boots.
Oh my gosh, I was a big Star Wars fan, and what every kid wanted, including myself, was of course the Millennium Falcon.
And I really wanted snow. I hadn't seen snow in a while, especially like a white Christmas, right?
I always wanted to go to Taj Mahal.
Well, I really wanted a puppy and I didn't get the puppy.
The one thing I really wanted as a kid was an umbrella. And I begged for it and I didn't get it, and I don't know why, because it's such a simple thing.
The one gift I didn't ever receive when I was a kid was night vision goggles.
When I was a kid, I really wanted the Barbie camper van. Never got it.
So one of the things about being part of Lawson that is really nice for me is being able to actually get the interactions with patients and their families, and not just people like that, but also the donors.
One of my students, A.J. Rajaram, has been working on building a new device that will allow us to monitor the cerebral blood flow and metabolism at the bedside for preterm babies or babies who are born and who are suspected of having a brain injury.
I did a sort of a large contract with Danone Research in France, and certainly as part of that project, Lawson was intimately involved, and they were extremely helpful.
In one particular area that I start this year is to find a new method, very convenient method to cool down the brain so that you could limit the brain injuries in neuro emergencies like trauma, head trauma, stroke, or resuscitated cardiac arrest.
But there have been a lot of valuable interactions and, you know, opportunities that have come through being part of Lawson and being part of the cancer program. So I'm really thankful for that.
My research gives me the opportunity to interact on a daily basis with a number of patients here at London Health Sciences Centre, and it is truly heartwarming when you hear how much their lives have been improved.
I have amazing PIs and amazing collaborators that are experts on their field, and they have taught me many things.
Something at Lawson I've been really grateful to be part of this year. I guess going to a number of places around the world and telling people I worked at Lawson and seeing a nod of recognition.
I'm grateful to Lawson, really, because fundamentally they support and facilitate our research in pediatric oncology to ensure that all children affected by childhood cancers can look forward to many Christmases to come.